of it, and he was talking about what that's like for people. People without connection are apparently vulnerable to building those new circuits in their head that we don't want. So what do we do about that? Well, we're going to hear from Josh and others about what we do about that. But I'll just run through a couple things. Obviously, we need to have the person stop using the substance, because the access to the substance, access to the people and the places and the things that have to do with using that substance, if we're talking about a chemical dependency, a substance addiction, that keeps those circuits turned on. It maintains them. So you kind of stop the maintenance of the new circuits that force that person into this compulsive behavior pattern. And there's some really cool neuroscience coming out that at a minimum of 8 weeks, because that's what it takes for the chemicals that maintain those circuits to kind of break down. They're kind of like, you know how if you leave a glass of wine out, it turns to vinegar, the chemicals just degrade in there. It's not rotting, it's just, they just degrade. Well, the chemicals that kind of maintain those new circuits take 6 to 8 weeks, maybe 12, for them just to break down and disappear. After 6 to 8 weeks, the biology starts to become vulnerable towards, okay, maybe we can reprogram this brain a little bit. What it takes to help a person break down those old circuits that I was showing you that they formed and form new ones is probably more about the social than the individual. We want them to reconnect, if you want to think about it in terms of neuroscience, reconnect to the front of their brain, start thinking about choices, healthy choices, that sort of thing. We want all that to happen, that's for sure. And there's an individual counseling, individual therapy component to that, for sure. There's also medications that can speed that up. I mean, that's what we do, right? We like medications, so we're coming up with some pretty good things. And just to warn you, CBD is going to be one of them, used in certain ways to help reverse the process of addiction. Just, I'm warning you. The drug companies are now working on formulations, not of CBD, but that increase the level of that particular component of the marijuana plant that seems to help us reconnect. But it's really about stopping the behavior, not being, we call it triggers, but getting away from the people, the places, and the things, and then working on the reconnection. That's what we'll be hearing about, I think, a little bit from Josh. And what his, I told you my son's story. Clearly, his story is about finding connection. What worked for him was connection. I'm kind of bought into this. So I think I'll stop now. Do you folks have any questions about what I presented? Anything you want to discuss about that? So what you're saying is, what if this is the lever or the cocaine water? Methamphetamine is a stimulant like cocaine. It works kind of the same way that I described for cocaine. So what if you keep doing that and doing that and doing that? Well, it turns out that system I showed you will adapt. I didn't go into it because I didn't want to overload the neuroscience, but that system that I showed you, the ventral tegmentum, it's got its little projections, arms squirting dopamine onto the nucleus accumbens. The nucleus accumbens becomes less sensitive to the dopamine over time. Our bodies are amazing things. If you give us too much of anything, our whole nervous system sort of adapts to kind of get around that. That's why I say morphine, opioids usually will stop working after a little bit of time, because we really don't want our bodies not to be able to feel pain. You have to feel some pain to be able to protect yourself, so your body will increase the sensitivity of the pain circuits. Well, if you blast with dopamine, with dopamine, which is what methamphetamine does, causes the release of a lot of extra dopamine to accumulate in the reward circuit in the brain, the reward circuit will become kind of numb to it. And you'll have heroin addicts will tell you, it's not the high, it's just I'm using the heroin partly because I can't stop myself from doing that, and partly because I don't want to withdraw. Does that make sense? That's why people will use more and more and more of the drug as their system sort of kind of fights back and says, it becomes numb to the effect of the drug. Is that what you meant? It doesn't burn out the dopamine receptors. The way that works, you're not born with dopamine receptors and you got 10 of them and that's it for life. Dopamine receptors are on the surface of cells and they last a couple weeks. Your body's always replacing them and making new ones. So you can make new ones in the right circumstances. I don't know if I really answered your question, but if the person is out of that circumstance for a while, they'll recover. Their bodies will recover. I didn't say this too much, but there's something about that rewiring that we can reverse, but we think that probably not completely. So people who have been, through addiction, if they go back to a place exactly where they were using before, we call it triggering, it's gonna start to tickle that circuit again. So it's almost off, but not all the way off. I just wanted to kind of throw that in there. But most of it is reversible. That's a good question. I don't know if I really nailed what you were looking for. Burning out the dopamine receptors. Yes, they can. They can. You can, again, the brain and the nervous system in particular is an amazing thing. We can heal our bones. You can break a bone, it'll knit back together and look normal again. Our nervous system can make new connections, break old ones. It does it all the time. That's what a long-term memory is. If you remember anything from childhood, that's about 200 nerve cells, neurons, that formed a little movie and can play it for you. And before that experience, whatever it was, a birthday or something that happened, those neurons didn't have that little network. You had that experience, they formed the network, and they can play that movie for you 50 years later. That's an example. We do it all the time. Our brains are constantly rewiring themselves. Any other questions on what I'm talking about? Yeah. Okay. Relapse is part of recovery because it is. That's an experience. I mean, we've seen it. We've just learned that over time. If you try to say relapse is a horrible thing, that's not really no. It's likely to happen. So a couple things. Early on, of course, it takes the brain a long time to rewire. If you want to know, people ask me this a lot. How long does it take the brain to rewire? Well, then I'll ask them, how long does it take to learn a golf swing, to hit a golf ball far, straight, consistently? It takes months. What you're doing is rewiring your brain to do that weird pattern that weird motor pattern, relatively simple compared to behavioral things. You're rewiring your brain to do that by practice. You're repeating it until your brain goes, okay, I think I'll hardwire it because apparently she wants me to do this way, so I'm going to hardwire it this way. It takes months. So during that rewiring period, of course, the old circuits are still there and they're not rewired. There must be something, though, in terms of what he's talking about, something about the social cues, the fact that people, I guess it's more about the fact that people with an addiction disorder have bonded with the people, places. It's not just the drug. The drug's part of it, hitting the pleasure center, right? Making them feel good. So that feel good associated with people and places, that all gets mushed together in the hippocampus and you remember it. Those memories are there. You still have memories from childhood? Those circuits are still there. So that they're still there in the background, and in times of stress, maybe, lack of feeling connected, if you want to use that term, it'd be pretty easy to go back to that old pattern. It's always going to be maybe easy. We don't really know 5, 10, 15 years down the road exactly the biology of it, but usually when you break it down, something has happened, loss of connection, loss of a loved one, something has happened to break the connections. And oh yeah, there's this old pattern that I used to do. And it's still, the shadow of it is still there. It can still be wound up again. Am I answering your question?
With each relapse, it seems like there's harder consequence. I guess to understand,
Remember when remember when that behavior circuit gets turned on, that compulsive, it turns off the consequences? The consequences are turned off at the same time, so that's not part of it. Let me flip the script a little bit. So you said something that I've noticed is taking notes and keeping track of patients I'm taking care of now, that you just said. So you said the consequences get worse as people get older and their lives get more complicated and the more responsibilities and that sort of stuff. The consequences get worse, off camera, the consequences get worse of the relapse. But is that really what happened? I mean, what triggered the relapse? Was it a big loss in their life? was the depression, the hospitalization, that kind of stuff, and the relapse part of something, loss of connection. Does that make sense? Maybe they're all part of the fruit of the same tree, but the root issue was a loss of connection, a trauma, something like that. Does that make sense? That might be why, as we get older, you know, we lose family members. Things can get kind of more severe than this little bubble of being a teenager and that kind of stuff. Sometimes they can. So maybe what you're describing is a pretty potent loss of connection that leads to all these ripples, including a relapse and maybe a hospitalization. It wasn't the using the drug that got you depressed or anxious. Does that make sense?
Yeah.
Does that seem possible?
It's possible, but it's just hard to understand as a, you know, we know consequences. If we do something wrong, we have consequences. We don't go back there.
Know that
Our brain hasn't been, you know, so it's just hard as an outsider or a parent of
very hard. That is one of the
understand it.
one of the main reasons I did this. I did this slide. Is it going to work? There you go. Turning off the consequences. When this circuit gets turned back on years later, it's still there, not being used. But if it gets turned back on, people lose connection. Say it gets turned back on. This part of the brain shut off. It's not in control. It's not consequences, consequences, whatever. It's literally not. Remember, I showed you that picture of the frontal cortex just not being quiet, just in neutral. That's for real. Yeah, all the way to the jail or whatever it is. You know, right? Yeah, a couple more.
What about relief anxiety?
So those are two different questions. I'll address one. There's really good information, really good data from the opioid use disorder population about Suboxone and methadone. It's called harm reduction. So methadone and Suboxone are used in the same way.
Correct.
To kind of build people a bridge as they're working on breaking down those circuits and those patterns and getting this. No, it doesn't. It's just a bridge to reduce cravings for the most part. That's the point, is to reduce, is to kind of keep this placated, keep that circuit quiet so they're not going to run out and go back to the drug dealer. They've got the Suboxone or the methadone on board so they can just kind of pay attention to their life and start to groove some new circuits, start behaviors and patterns in their life, start to meet new people, build connection in their life, right? In terms of what that guy was saying, without having this circuit just screaming at them, go get it, go get it, go get it, because you've got a little bit of Suboxone and methadone on board. The big question is, when do we stop that?
Right.
And our addiction, I'm not an addiction medicine doc, but that community doesn't have an answer for that yet. And that's what a lot of people like me are saying, okay, but you know, that's a bridge, right, to get to a new place. And when do you wean them off? How do you know when you've gotten there? When you wean them off? Well, that's why that TED Talk, that's pretty new stuff. 2018, I think. That's pretty new stuff. And he's kind of talking about what the end result looks like. Okay, do they have connections and are they ready to wean off? We get people on the medically assisted therapy, we call it, MAT now, on the Suboxone or the methadone. We get them on that, but then what? Just keep doing it the rest of your life? Some people say yes. There's some people in the addiction community that say yes, in the medical addiction community. But there's a lot of folks saying, no, that's just a bridge. It makes sense. I'll just tell you, there's really good data in the heroin population and opioid use disorder population that using those two drugs, either Suboxone or methadone, as a bridge reduces overdose deaths. Really good data. Overdose deaths. Harm reduction. It really, really does. And that's not a question anymore. I still hear a question, but it's not a question anymore. It reduces overdose deaths in that first year or 2 years of trying to get out from under the habit, if that makes sense.
I heard like withdrawals from methadone are just as bad, if not worse.
Stop it. You have to wean that very slowly. Methadone has to be weaned very slowly, months. Yeah. And
Be what?
weaned, stopped very slowly,
Okay.
over very slowly. And everyone's different. You know, that's a very individualized thing. Right. Yeah. And it can be done. It can be done. You asked about using marijuana products, I think?
Correct. Cannabis.
Oh boy, another TED Talk, another whole subject.
There's like I read different things on the internet with the it does, yeah, it becomes that.
Okay.
vicious-
Well, it does treat anxiety. There's a whole, as I was saying, there's a whole, tidal wave of using CBD, THC, those sort of things for medical conditions that's coming, but we're not there yet. Because of federal restrictions on research in this country, we don't know enough to really make good drugs. So it's being done in Europe, but they're coming. But we're using the plant, this whole medical marijuana, the industry and that sort of thing, using the plant is just messing with Mother Nature. Marijuana has 257 psychoactive compounds in it.
To be addicting, is that what?
We don't even know how many of them, if we haven't even finished doing that rat place preference experiment with all those chemicals yet. Yeah, and it affects the immune system, it affects learning, THC affects learning, so a lot of our folks,
Ambition.
and a lot of our folks who are going into therapy to try to break this pattern right here and form new connections, turns out THC stops that. So if you're using THC while you're trying to do recovery, it's not going to work. There's chemical, this isn't proven, this is from the lab. This is from the rat lab. And I know this to be true in rats. I know it's true. You can give them THC and you can't teach them anything. They can't learn a new pattern. They can't find their way through a maze anymore, stuff like that. And you can modify that and so on, but we're just not there yet using cannabis products. We're just not there yet, so my advice is to people just stay away from them. There's a lot of other reasons,
The
but
Suboxone and the methadone.
for opioid use disorder,
Yes, for heroin.
yeah, main one, yeah.
Yeah.